Everybody should be into a chiropractic office. If you feel good, that's the best reason to go, because we want to keep you that way. Anybody who's really healthy and disciplined and doing the things that they should usually can see a chiropractor 3 or 4 times a year, and they're doing great. Most patients aren't that disciplined and might need to see a chiropractor a little bit more often. But going into the office saying, I still feel good, because really that's the point. Watch your stress levels. Look at your nutrition. Internet is all over the place, and there are so many things that you can do on the internet to see what is good for you and what isn't. And when you're not sure, find a great nutritionist in town. They're full of lots of good information and teaching you what you can eat and can't eat. And here's a quick remedy. Anybody hear about tart cherry juice or black cherry juice? Black cherry juice, or tart cherry juice, has a chemical inside it called pyrimidine. It's a natural chemical in the cherries. And they make it, they squeeze it and take the concentrate and they put it in a bottle. And you can do 2 ounces a day for about 6 weeks. And after that, you take 1 ounce a day, which is about a tablespoon. And you can take it with water, you can take it straight up, or you can mix it with juice. And it will significantly reduce the amount of inflammation within the body. It's a neat tip. Always accompany it with exercise. If anybody here is taking calcium and you're not exercising too, you're making your arthritis worse. And the reason is because your body needs to have a reason to use that supplement. And if you're not making the bone and muscle work against each other so that the bone pulls against the muscle and muscle pulls on the bone to request bigger and stronger bone cells to be created, you're just laying calcium between your joints. So that's really important too. If you don't exercise, rethink taking the calcium and just eat better foods that have more calcium in it. Otherwise, it's like taking a truckload of vegetables. Okay? So make sure you're doing your weight-bearing exercises. Questions?
I had a back chiropractic hearing. It was beginning of last year, about a year ago. And other than chiropractic and telling me I went to see a chiropractor there, and I expected him to do hands-on. And he didn't. He had this, like a wand thing that he used. Can you explain something about that?
Does it click?
I don't remember whether it did or not.
Yeah, there is. I'm unfamiliar with the wand. I hired a plumber to come do a job at my house. I'm not very good at fixing pipes. And he just didn't do the job well. But I still had a job that needed fixed in the house. So I hired another plumber, and he did a fantastic job, above and beyond. So there are good and bad professionals in every profession. I don't know much about that technique, but there is a technique called activator, and that is a tool that is used. It looks like a syringe, and it clicks. That's what the sound makes, a clicking sound. And the understanding behind it is when we use our hands to move a bone in a very specific direction with a very specific force and pressure and velocity, that is applied through a mechanical instrument. And it is very appropriate for patients, for example, who have just been in a car accident with severe whiplash and muscles swollen out to here and can barely move their head. The activator is a great tool at helping to begin to move the bone ever so slightly with very little discomfort. Or with a patient who has severe osteoporosis and cannot tolerate a high force manipulation, that tool is very useful. Or for a practitioner who has very large hands and fingers and they're trying to work on a little baby, then that tool is very specific and useful in that instance. Personally, I do enjoy using my hands. Chiropractic, the origin of the name, chiropractora, chiro means hand, and practora is the practice of. And I just enjoy doing it that way. I don't use an activator routinely in my office, but I have used it from time to time. There are practitioners that use only activator on all their patients, which is an option that they choose, and some patients prefer that because they don't like to hear the noise of an adjustment. By the way, I get that question very often. What is the noise that we hear when you manipulate a bone? Because it makes a popping sound. Kind of like the old wives' tale about popping your knuckles creates arthritis and swells your knuckles. It really has no fact to it, because the studies that have been done on that actually demonstrate a reduction in innate arthritic development and that it makes a loud noise. That was the result of that study. So manipulation of a joint that makes a sound, what it really is you take a bone that's connected with ligament tissue and other fibrous tissue that makes a synovial joint or other capsule. And when you align it just a certain way, if you look at that tissue that connects the two bones together under a microscope, it goes from like this to like this, which means it goes from a cross fashion to linear fashion and allows air and gas to escape through and diffuse. Now after about 20 minutes, that pressure is reabsorbed back into the joint. But our goal as chiropractic physicians to aid that natural nitrogen primary gas to be dispersed more evenly within the joint instead of unevenly to one side. If you've ever had I've got a pain right here, or it's right here behind the shoulder, it's usually on one side or the other, because that gas pressure has been displaced on one side of the joint. And so we want to push that out, move the bone back into a neutral position, and then it gets reabsorbed. Now, will it stay there forever? No, it won't. Actually, it has a memory to go right back out of alignment. It's kind of like, gravity always pushes us down. It's constantly on top of us. And it's our job as people of our bodies to try to fight what gravity is doing. And so as a chiropractor, I can move things back into place, but gravity is always pushing down and trying to realign our joints. And what happens is if it's pushing down on a building, the building eventually will crack and fall over. We degenerate. And so it finds weak points and it moves us this way and it moves us this way and this way. And what happens is it starts to begin to fuse. And calcium and other minerals and elements begin to be extracted out of the joint and deposited around those weak points where we subluxate. And that's where arthritis will form. I can predict when I see an x-ray on a 14-year-old, a 25-year-old, a 35-year-old, where they're going to have arthritis on their spine. Because I can see where the abnormal amount of stress is laid upon the spinal joints. Science has been able to find out what the ideal shape of the spine should be. And when it goes away from normal, we can measure that using physics and geometry to determine what it is that we need to correct through manipulation, through postural exercises, through other methods of physical rehab to begin to pull the spine towards that direction, or the other joint for that matter. And if it remains out of its normal position, the body says, wait a minute, there's an abnormal amount of stress here, so we're going to begin to glue it together. And that's what happens over time. So it is important to make sure that you keep those joints strong so that we can withstand what gravity is doing to us.
Yeah, people, I'm trying to remember whether like 3 times a week, for 2 weeks or 3 weeks, I'm not sure. But I was really looking forward to, hands-on. I just felt like
You needed something
probably
more.
get me really sooner than magic wand.
Yes. And again, I'm familiar with that procedure, but human tissue works a certain way. If you look through, and there's a lot of research on human tissue through the Journal of Manipulative and Orthopedic Medicine, and within that journal it shows that taking human tissue and changing it, it needs to be done no less than 3 days a week, no more than 4 days a week, because less than that, the memory of that joint moving out of position goes back to its original place, and one treatment builds upon the other. It's cumulative. And you can't stay ahead of it. And on the other end, you need to have rest, too, between care. And so it found that doing it 3 or 4 days a week over a period of time is what can make the acute change. Now, once you make that change, now it's up to maintaining that change. And I've had this really important question. Once I see a chiropractor, does that mean that I have to see a chiropractor forever? Why should I start? And really the answer is that it's not that you should see a chiropractor, have to see a chiropractor forever, you should see a chiropractor forever. It's just like going to the dentist. You don't have to go, but you should go. And you should go forever. But you also should maintain flossing and brushing and mouthwashing and don't eat candy before you go to bed, etc. Well, you've got the same homework for your spine. But I'm not a dentist, I'm a chiropractor, so I'm taking care of the spine and the joints of the body.
Where, like, is the sciatic nerve on the spine?
Where is the sciatic
Is it
nerve?
like a T12L1 place? Is that where it's at?
The sciatic nerve is a pretty famous one. You have 7 cervical vertebrae. You have 12 thoracic vertebrae. Then you have 5 more lumbar vertebrae. And then you have your tailbone called the sacrum. There are 5 lumbar vertebrae. And the lumbar vertebrae look exactly like this. The last 2 vertebrae in the spine, L4 and L5, come together, and sometimes you can include a little bit of 3, but primarily L4 and L5, those 2 nerves, they come together. And they form about the thickness of your 2 fingers, and your back is here, and your tummy is here. And that nerve exits right here. And this part of your pelvis is actually called your sciatic notch. And it comes right through the hip. And it comes right through the hip and goes down the back of the leg. There's an important muscle that travels through here, and it's the muscle that attaches to the pelvis and to the top of the femur bone and makes your leg turn out. And that muscle is called the piriformis muscle. And the piriformis muscle is intimately related to the sciatic nerve. And it's up to the doctor to determine what is it that will create sciatica. You've heard of sciatica, pain, terrible pain in the leg. Sciatica is inflammation of the sciatic nerve. Great, what's causing it? There really needs to be a more specific diagnosis. It could be a disc herniation in the spine, putting pressure on the part of the sciatic nerve. It could be a spasm of the piriformis muscle, which is called piriformis syndrome. It could be degeneration of the spine with arthritic pressure on the spinal cord, or stenosis of the spine, putting pressure on the nerve root that exits the spine. It could be a tumor growing in the pelvis that's putting pressure on the sciatic nerve. There's really a number of things that can create sciatica, and that is what makes up a sciatic nerve.
So you wouldn't necessarily have to have a bulging disc to have sciatic nerve pain?
No. It is very often that you have a bulging disc. It is the most common cause of sciatica, but doesn't necessarily have to come from that. And then once it's diagnosed, then you know how to treat it. For example, if there is a tumor in the pelvis putting pressure on the sciatic nerve, I can manipulate the spine all day long for a year and it will never change because it won't change the pressure on the nerve. That's a surgical procedure.